Hi guys, welcome to Lakshmi Dental Finishing School, the weekly podcast. I am Dr. Lakshmi. I have around 10 years of experience. I have my clinic in South Bangalore. My co-founder is Mr. Shyam Govind. He has done MBA from IIM Ahmedabad. He has been consulting various dental clinics across Bangalore also. We have started this page to have a platform where the dentists globally can come together, discuss few topics, share their views, share their experiences. As professionals, we can be a better person by learning from those things. Today, I am here to discuss about the coronavirus and dentistry. As we all know that as dentists, we are exposed to the body fluids a lot, the saliva, the blood. We have a moral responsibility to protect ourselves, plus our staff, plus to prevent cross infection between the patients. For those things, there are articles from WHO, there are articles from other dental associations. So please read from the trusted sources and keep updating yourselves. And every week it will change. Maybe after 1 week it will be a different. We are at a different stage right now. Then in the next week, maybe we will be in a different stage of the outbreak. But right now, after reading the articles, after having chat with various colleagues and seniors, I have formulated around 12 steps which we can do in our clinic so as to help and prevent the spread of the diseases. So let's discuss those things, and I would really appreciate and love to know what all things do you do in your clinic and your work setup. Please comment and let us know about it in more detail. And if I am missing anything, I would really love to know about it more. Thank you. So let's discuss that. First is the waiting area. The waiting area, we have prepared a questionnaire which we can ask the patients before they enter into the treatment space. So my reception area, the staff, everybody has been trained and sensitized, and they have been told what all actions they have to take. So first, in the reception area, a questionnaire is given to all patients. That questionnaire contains that whether in the past 30 days they have traveled abroad, and if abroad they have traveled, which countries they have traveled, and have they traveled to the 6 countries which the government has told as a source of infection, like the China, South Korea, Italy, Qatar, Middle East, or Iran. If they have traveled in these areas, and if they have traveled, when they have traveled. And next is have they been in contact with somebody who has been abroad, or do they have any symptoms like fever, cough, sneezing, sore throat, running nose, anything do they have? So these are the questions which we have created a questionnaire, and we have asked the reception area to distribute to all patients. And if any of the answer of these questions is yes, then we have to decide whether the treatment which that patient requires, is it a elective treatment or a emergency treatment. If it's an emergency treatment, we have to isolate it accordingly, and after that patient we have to do the precautions so that the next patient whoever coming up doesn't get the infection. And if it is an elective treatment, it is better to postpone it to after 2 weeks. After that, we can proceed with their treatment. So this was the first point. Second point is that in the waiting area, if somebody is coughing or sneezing, has any of the common cold symptoms or any symptoms, we are giving them mask so that the other people are also protected and comfortable. Next, third point is we are checking the temperature of every patient before the treatment is started through an infrared thermometer, so that the thermometer also doesn't come in contact with the patient. And if any fever or anything is recorded, then the necessary steps are taken according to that. Fourth step is we are spacing out the appointments such that there are not much people waiting in the waiting area. There will be only 1 or 2 patients, not more than that. And that too also, we are trying that everything is spaced out. If some walk-in comes, then we can't help it. But otherwise, appointment patients, we are trying to be as much punctual and as much spaced out as much possible. Fifth step is, as dentist, we are wearing protective eyewear, mask, disposable aprons, head cap while doing the treatment for every patient. Sixth, the assistants, they are also exposed to the aerosols, so they have been given gloves and mask when they are assisting us while maybe holding the suction or etc. While doing any treatment, they also have to compulsory wear these things. Seventh is that the waiting area, the chair and the doorknobs, everything which comes in contact with the patient, everything is cleaned frequently. Eighth step, every patient, every staff, let it be dentist or the assistant, they have to wash their hands according to the WHO recommendation for 20 seconds after every patient. That's a compulsory thing which we have started in our clinic. Ninth step is that while working, the patient have been given disposable aprons. They are given tissue papers. They are asked to rinse their mouth with mouthwash before starting the treatment so as to decrease the microbes which are there in the saliva. Next thing, the other thing is we are using the rubber dams and high-end suction for all treatment so as to decrease the aerosol production as much as possible. 10th point is we are using the closed dustbins so as to decrease as much contamination as possible. 11th step is we are having a list of the local hospitals where the coronavirus testing is done, and definitely the helplines, and we are giving that to the patient who all require it. 12th point is if any staff is unwell or showing any symptoms of the common cold also, we are asking them to stay at home for 2 weeks and then later on join for working. So these are the 12 steps which we have started implementing in our clinic, and definitely this list will keep on updating as soon as something new we will learn about the coronavirus, and maybe in the different stage we will go at a different steps will be taken. But I would recommend all of you to please kindly keep yourself updated from the trusted authorities. And I would really like to know if I have missed anything or if anything can be added to this, and what all things do you guys do in your clinic. Would love to know that. So thank you very much for listening, and please kindly follow and like this page if you want to get updates regularly for any upcoming event or any podcast, whichever we will be posting on the page. So have a nice weekend, and hopefully you enjoyed this video. Thank you.